Leaders at Prince George's Hospital say they are getting ready to handle coronavirus cases in our area.
We are literally monitoring every minute of the day what is happening in the community, who is coming into our doors, and how we respond.
The hospital CEO, Dr. Joseph Wright, says the Maryland Department of Health issued a surveillance order starting Wednesday, meaning they'll track everyone coming in with a fever, cough, or upper respiratory illness. So if there's a confirmed coronavirus case here, they can quickly figure out where it's concentrated and how it's spreading.
We do not have any patients right now who are positive for coronavirus.
Dr. Douglas Mayo says everyone coming in is already screened for the virus, which focuses on two areas:
travel and potential exposure. So if they travel to a high-risk area or if they've had exposure to a patient who's known to have COVID-19.
He says if doctors are suspicious, the patient is given a mask, isolated in a triage room, and eventually a negative pressure room like this one. It doesn't allow air to flow back into the hospital. From there, they continue to evaluate the patient and decide if testing by the CDC is necessary.
That's our job here on the front line.
Now, I do want to point out these protocols at Prince George's Hospital are not unique. Most area hospitals have similar plans in place. I'm Lorenzo Hall, WUSA 9.